This episode of The Benefit Whisperer is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. Welcome to The Benefit Whisperer, the show where we pull back the curtain on what's really driving your healthcare costs and what you can do to stop feeding a system that's rigged against you. I'm Ralph Weber, The Benefit Whisperer, and today we're exploring a benefit strategy that prioritizes faith and financial stewardship, something you don't hear often in the traditional insurance space. I'm joined today by Ericka McPherson, Executive Director of Covenant Choice, a benefits organization designed for Christian employers who want to provide high-quality healthcare options while staying aligned with biblical values. Covenant Choice isn't about doing less, it's about doing healthcare differently. Ericka, thank you for being here today. Honored to have you. And can you tell the listeners just a little bit about yourself and how Covenant Choice came to life?
Yeah, sure. Thank you, Ralph, so much for having me on the Benefits Whisperer. So I stumbled upon Covenant Choice after I was general counsel for a organization here in Oklahoma. And I also, as part of those duties, oversaw the Human Resources Department and became very familiar with costs associated with self-funded healthcare plans. And with that, I was connected with a contact who I worked with on our self-care plan. And they said, Ericka, we think you would be a great fit to be able to lead this new organization to where we are trying to create a faith-based community and allow Christian employers who would like to have a practical, stable, affordable, and flexible employer health plan option that aligns with their Christian values. So with that, I decided to continue both my faith values and put my talents into the healthcare space and decided to join Covenant Choice.
Wow, that's a great story. I myself was led to the benefit space through a passion, through something that happened to where I thought I could make a difference. It's good to hear that, that's where you came from. So specifically, Covenant Choice, you've already explained. Was there sort of a defining moment when you said, this really needs to exist?
Yeah. So one of the things that I thought was so impactful for what Covenant Choice does is that it really sets apart your traditional stop loss health plan options in the marketplace from more of your traditional avenues that employers look to. And what sets us apart is the fact that Covenant Choice is connected to an organization called the Christian Employers Alliance, otherwise known as CEA. And they advocate both in the legislative world as well as the legal world to be able to ensure that Christian employers have a voice when it comes to different policies and procedures as they go through their business. And what's neat about us is that Covenant Choice through the CEA is able to offer what's called associational standing that allows for our members to have legal protections through legally fixed exemptions that support Christian employer rights.
So the tagline on your site says healthcare that honors God. Is that kind of what is meant by that, or is there more to that?
Sure. So again, I think a lot of times whenever businesses are putting together their healthcare plans, they don't realize what all they're paying for. And a lot of times it isn't until you really stop and look at the actual things that go into figuring out, from an actuarial standpoint, what all the costs are associated with whenever you pay your claims as well as your monthly premiums. What is that made up of? And from a Christian employer's perspective, sometimes those things are mandated through state regulatory bodies or state law that they may not realize are objectionable to their faith. And so as a Christian, you may believe that those are things that are objectionable to your faith and that you would, as a private business owner, would like to exclude from your healthcare plan. So with that, we're able to do so under federal law utilizing ERISA.
Wow, that I'm sure gives a lot of comfort to Christian employers because, as you point out, the state sort of the fully insured plans that are offered state by state and the individual plans cover a lot of those things, which they, if they had the choice, wouldn't want to pay for, and this gives them the opportunity to do that. So that's great. So. How does a Christian employer's approach to benefit differ than regular corporate insurance?
Well, at the end of the day, it's really the same thing. And it's ultimately up to the employer to be able to utilize the tools that are available to them to help control their costs, as well as build a plan that is the best for their particular business and how they want to, carry out their mission in their own business industry. So with that being said, a lot of the tools that we utilize at Covenant Choice are similar to what you're going to traditionally find out on the marketplace. For example, we have different ways to help spread risk amongst faith-based members that share the same values that you do, ensuring that they're able to utilize PBMs that are transparent and that the employer are able to really understand the different cost containment strategies that are available to them as they build out their healthcare programs.
Now, of course, you also use a captive to kind of, pull the Christian employers together to a degree. Is that also part of the strategy?
Yeah, absolutely. So the Covenant Choice Captive is a healthcare program, and they reinsure the stop loss policies of multiple companies, making it a larger and more diverse risk pool. So the members of Covenant Choice are able to access this program, and they vary by regions, they vary by industry, and making our program a very diverse risk pool. And we're able to create balance in cost containment solutions amongst the entire membership pool.
Wow, that's great. I think you've got a lot of really cool elements in place there. So, what kind of solutions do you bring to the table that standard, run of the mill brokers or carrier reps normally wouldn't, at least wouldn't start with?
Well, again, Ralph, we do offer that associational standing through the Christian Employers Alliance that in the event that an employer was, let's say, sued because of, it was assumed that they were discriminating against a particular employee because a claim was filed as something that was objectionable to their faith that they believe that, they should exclude because of their faith. And let's say they got sued for that. We at Covenant Choice are able to assist with the associational standing component to where the Christian Employers Alliance actually has court orders on the record at EEOC and HHS that states that these particular exclusions are allowed under federal law and that it should not be considered discrimination. And they're able to do this because each individual employer that is a member of CEA are able to exclude the things that are objectionable to their values, and they are able to stand on their religious freedom protections.
Right.
So
Now,
that's I think the most unique.
yeah. No, I agree. I agree. And of course, you being an attorney, you're the right person to say, hey, listen, and interpret that and explain it to the employers.
Yeah, absolutely. And again, as a follow-up to your question, all of our members at Covenant Choice are able to retain control over their own plan design, except for some of the exclusions that, we ask for our members to exclude because of the faith aspect.
Right.
So with that being said, they still control their PBM design. They still control who they utilize for a TPA. And the neat thing about us is that when you join our captive, you're able to potentially in a good year have a distribution back to our members, which is great. Because in a traditional healthcare model, if there's profit to be had, historically, those profits are going to be withheld by the carrier. In our model, with a captive model, we're able to give money back in the event of a great year.
Wow, that's good. Talking about the control aspect that you were just mentioning. So an employer is able to have above and beyond the carve-outs that you've mentioned. They're able to have other carve-outs. Can they do different networks or reference-based pricing plan or a mix of the above?
Yeah, absolutely. And I think, Ralph, that's what makes our option so appealing is because we are very flexible and we realize that the benefit structures for each individual employer are going to be different for various of reasons, whether it be what network they have access to, whatever the limits of liability that they want to access, whatever PBM they want to utilize, the different types of things that they want to cover or not cover. For example, we really feel like each individual employer should be working closely with their broker to determine what is best for them. And like I
Right.
said, we are agnostic when it comes to various things except the exclusion components that can impact somebody's religious values.
Sure. And those themselves save a little bit of money too, which is, another bonus. The beauty of a self-insured plan is that you're able to do this. You're able to carve out any one of the 10 essential health benefits that are mandated by state insurance, in addition to carving out just a portion of one. So that alone can decrease your costs a great deal, and a very good benefits consultant can help you to design those plans. And of course, we're always happy to consult with a broker and help him or her to design that strategy that has just that really nice fit.
Yeah, absolutely. And at Covenant Choice, we're broker friendly and we want to be able to work with the broker and employer to make sure that we are finding a solution that's going to work best ultimately for the employer.
Okay, excellent. How does an employer join Covenant Choice and or the CEA? How does that work?
Well, I think the best thing to do was just reach out to myself and I can help guide them through that process. They can visit the Christian Employers Alliance website and learn more information there, as well as look at our website, covenantchoice.org, to learn more. And if they're interested in getting a quote, we actually have a quote inquiry button that will be sent to me, and we can continue the conversation from there.
It sounds like it's pretty easy. So that's great. Behind the scenes, are there any other sort of moving parts that are different than traditional coverage?
I mean, at this point, I think we've discussed most of the differing
Right.
factors between Covenant Choice. However, again, I really just want to emphasize the importance that Christian Employers Alliance and Covenant Choice is there to give Christian employers a solution to those issues that maybe they weren't aware of existed on the marketplace. And we would love to work with them to be able to find maybe what benefit program that we offer might be the best for them.
Right. How about small employers? Is there a size of the captive that's the target size, and what do groups with different number of employees do?
Sure. So our captive can actually go down to, it's going to vary upon regulatory standards in each individual state. Typically, the lowest that they will go is 25 to 35, depending on the state. However, the captive model is really, I believe, best suited for groups, I would say around 75 or more. We do offer programs tailored just for the smaller employer groups that are interested in faith-based programs. We offer two different programs, and we would love to visit with the small groups to see which may be a great fit for them. And we can serve anywhere down to employers of 5 employees all the way up to the 100 employee threshold on our smaller group programs.
Right. That's excellent. We've been involved. Route 3 has been involved with a lot of those on the level funded basis, and we've seen potentially massive savings. On that one employer that I spoke to just recently. They're on a fully insured plan, and when they finally looked at their actual information, their claims were only about half of their premium. So, the insurance company was making a ton of profit. But another thing that is unique about this model is that employer had one expense for a hernia repair that was $131,000, which is very expensive. So having a self-insured plan gives you more insight to that kind of thing. It saves you money, but it also lets you say, wait a second, that is not reasonable.
Yeah, I agree, Ralph, that it is a great tool in the toolbox for those smaller employers to really understand what costs are going into their healthcare costs. You know, most employers, especially smaller employers, one of their largest costs are actually from the healthcare standpoint. So it's very
For sure.
important that employers have the ability to look into the line items, the what's driving those costs. When you go to a level funded program, you're really able to see more behind the curtains as to what their costs actually look like and what helps make up those costs. And another thing that's great about our level funded program is like our captive, where we're able to offer a distribution back in the event that, you know, it's a good year for everybody. We can do so for our smaller employer programs as well, which is another great, benefit of being able to be a level funded program or in the captive.
There are a lot of benefits, and it's great that you are offering these to a group of people, a unique group of people that prior didn't have access to that. So, do you have any success stories that you'd like to talk about? Any that come to mind?
Yeah, so I think that one of the things that we've been talking about lately on the captive standpoint is that we have had our members really experience pretty low rates as they start, their renewal season. We have seen rates that have been renewed for less than 8%, which is great. Some have been as low as 4. So, enabled to look into those costs. Again, everybody's working together to be able to help see where the costs are, where the costs are being derived, and working as a group of faith-based leaders to help drive down everybody's costs is really a benefit on so many levels. And we just feel like it's a really unique tool that we are so privileged to offer and excited to offer to the faith-based community.
That's great, Erica. So, what do employers tell you when they experience a healthcare plan that's really built around their values rather than the insurance network and what they dictate?
Yeah, so I think that employers that are able to express their faith through their plan values are able to, continue to live their life in all aspects of how they believe that they want to live out their faith and making sure that they're following through the mission to be able to honor God in all things that they do, including their work as well as their personal life, which I think sometimes that's really hard to do. And I think it's a very honorable thing that as we all continue our walk, that we're looking for different ways to honor God and to be able to think through different solutions that not only honor God, but also are beneficial in regards to our employees and as well as our mission to be able to have a successful business. And again, it all goes back and flows back to that we are honoring God and following through with His mission for us.
Absolutely. Uh, Erica, that's a great point. And you said a little while ago, you said something that was pretty significant. Most employers, their healthcare costs are usually the second biggest cost right after payroll.
Yes.
And to have something that you're spending that much money on, I think an employer that's spending their own money should have a lot more control. And you have given them a way to do this now.
Yes, exactly. We have given them the tools in the toolbox to be able to implement not just cost saving tools, but also faith based tools to help them align with their values, which is really a great thing that we're proud to offer.
So, are you seeing anything, Erica, in regards to retention, like better retention, better morale, people really appreciating that they're not just dealing with a big insurance company, but they're dealing with a plan that really aligns with their values?
Yeah, I think that the biggest component that self-funded employers, and not just faith-based employers, but just self-funded employers in general, that they are able to see employees that are happier on average because they're
Mhm.
really able to take in their individual employee needs and ensure that they have the various tools that are best for their employee population. And I believe that employees appreciate when employers are able to really get down to the nitty gritty and understand the employee base and the different options in the healthcare space that are best for not just the employer, but best for them, because that helps everybody's costs decrease. So whenever you are able to cut costs from a larger scale, those cost savings do trickle down to your employees, which ultimately is great for retention and ensuring that employees want to continue to be with an employer that has a benefit plan that also values them as well.
Yeah, you're absolutely right. And a, a plan that honors them, that in itself is a great statement, because most big health insurance companies don't do that. We hear about medical bankruptcies all the time and dissatisfaction and why was this covered? Why was this not covered? So this is a way for employers, Christian employers, to really take a lot more control back.
Yes, and I think at the end of the day, it's not just a benefit to the bottom line, but it's a benefit to everyone involved. Complete structure from the employee all the way up through the owner of the company.
Yes, it sure sounds like it. So there's a growing movement among Christian businesses wanting to get out of the insurance industrial complex. What's holding them back right now?
Well, I think a lot of the issue resides with transparency. So I think that there is a need now to where the marketplace is really demanding clear fees and reporting results on different programs. And through Covenant Choice, we are also able to provide that transparency that is so desperately needed in the healthcare space.
Yes, absolutely. That reporting is important, the transparency. We talk about it all the time. We want it, but we often don't get it. So it is great that you're able to do that as part of the mission. That just makes it even more complete. So if an employer that's listening right now feels stuck in a legacy PPO traditional insurance plan, what should they do first?
I would say reach out to myself or reach out to Ralph or your benefits broker and visit with them and really take a deep dive into what is driving, why they may not be satisfied or why they may potentially need a new solution. I think it is good diligence to be able to review your healthcare plan and not continue to just let things roll over year to year.
Right.
Because when you do take a good, deep dive and look at your structure and look at your costs, I think that that's a really great way to add additional value and really understand if whatever you're doing is working or not, whether it be from the faith-based perspective or a cost perspective or both. So I think, the most important thing is that employers really should be reaching out to, the experts, looking at the bottom line, getting their reports and working through what potentially, if not working for them, let's work through what can work for them and find them a solution.
That's a great point. Most employers, nobody really wants to deal with healthcare. They do because they have to, not because they want
Right.
to. Employers don't want to become the expert. I mean, they need to know a little. They need to get involved. They need to see where they're spending a lot of money. But having these tools all helps them to do that. So this is a great solution that you've put together. Thank you, Ericka. So how can a church, a ministry, and other just general Christian-owned businesses collaborate? And I know you've mentioned a lot of these, so let's just kind of sum it back up. How can they collaborate to get more leverage in this space?
Well, they can come together and join the Christian Employers Alliance as well as Covenant Choice and work together to formulate a group that shares similar values as well as a desire to create cost containment solutions for their healthcare plans. And we're able to offer them that community to do that.
That's great. Ericka, thank you so much today for joining us and showing us what it looks like when benefits are built both on biblical values and sound financial strategy. But before we wrap up, if listeners want to learn more about Covenant Choice or see if it's a good fit for their organization, where should they go?
Sure. Again, you can reach out to myself, Ericka.McPherson at covenantchoice.org. You can visit our website, covenantchoice.org, or you can also find us through the Christian Employers Alliance website, and we can go from there.
Excellent. Thank you. So to everyone listening, your value shouldn't be a liability in healthcare. they should be an asset and something that you can manage. You don't have to choose between honoring your mission and managing your margins. You can accomplish both at the same time through covenantchoice.org. Thank you for joining us today. I'm Ralph Weber, the Benefit Whisperer, and if today's episode got you thinking, share it with a business leader in your community, a friend, relative, subscribe, like, and share, and reach out to me anytime. My email address is ralph@thebenefitwhisperer.com, or you can call 832-924-3330 or visit www.fixmybenefitsnow.com. Let's keep building plans that work for people, not just for profits. Thank you for joining today.